Ever wonder why wounds itch as they heal? This is kind of similar to if you've maybe gotten lidocaine at a dentist's office, and as the lidocaine wears off, one of the first sensations you get is this kind of itching, tingling sensation. When I get that, it drives me crazy because the itching is so deep in the skin and I can't really scratch it because it's numb, but it's still itchy. Well, wounds are similar in that way. You probably severed a lot of the nerves that actually are responsible for pain, but as you start to heal, the itch nerves actually come in and get very much activated. It's important to understand that it's just a natural part of the healing process. The question is, how do you manage that when you start to get this kind of itching across different kinds of wounds? When patients experience itching in a chronic wound or healing wound, these are the things that I suggest. Make sure that the wound is nicely moisturized with Vaseline or Aquaphor or other really ointment type moisturizers. If that doesn't work, sometimes what you have to do is escalate even in a judicious fashion with, say, even topical steroids or a calcineurin inhibitor or even a topical JAK inhibitor. This really gets at some of the inflammation. Sometimes the wounds will heal in such an abnormal way that they'll form what's called a hypertrophic wound, where it's a thickened wound, or even what's called a keloid, where you actually develop a nodule. These can be particularly itchy. Those anti-inflammatory agents can work that I just described, but you may also have to see a dermatologist in those cases to get injections with steroids.